Sciences Research Council and the University of KwaZulu-Natal's Nelson R. Mandela School of Medicine have released the results of a survey looking at the impact of COVID-19 on health workers. The study was aimed at ascertaining the impact of COVID-19 on South African health workers, both physically and emotionally. Professor Mosa Moshabela is with UKZN. He joins us now. Very good evening to you, and thank you so much for joining us, Professor. So globally, more than 90,000 healthcare workers are thought to be infected with COVID-19, and more than 6,000 deaths have been recorded. But what does South Africa account for in these numbers?
Yeah, in fact, Tsepiso, greetings to you and your viewers. But the 90,000 was actually at the time that we did the study,
okay,
which was back in April. I mean, right now in South Africa, based on the report from the minister, we are looking at already more than 24,000 healthcare workers that are known to be infected, and close to 200 deaths, and that is a significant number.
So let's talk about this particular survey. What did it look into specifically?
Yeah, so we looked at specific components, looking at the various aspects related to healthcare workers. Mainly, we wanted to basically look at their knowledge, their training. We wanted to look at their sources of information. We wanted to look at the risk factors that they have for COVID-19, their risk perception. And we looked also at issues of their general health and well-being and the use of PPE. We had looked at some numbers relating to the infections, but because we did the study early in the pandemic, the numbers were small, and hopefully we'll be able to give a better estimate of that in the follow-up study.
I think what is interesting to a lot of us, and actually should be interesting, because we must put a face to these healthcare workers who are on the front lines, putting their lives at risk for us. So tell us about the general demographic profile of the respondents.
Yeah, that was very interesting. So basically, we found that most of the health workers are below 50, about 10% were more than 60. But majority of the participants were nurses compared to doctors and other health professionals. What was interesting for us, though, was that we're able to capture a diversity of healthcare professionals besides doctors and nurses, but including pharmacists. But when we were doing the study, we found that there was a lot of disgruntlement amongst pharmacists and nurses, and they were initially reluctant to participate. We had to kind of encourage to participate. But the issue of how you identify health professionals is important to them.
And when you talk about that relatability, just looking at the stats, I mean, it's quite interesting that they actually fall within the category of those most vulnerable, because it says here that 4 of the 5 participants are female and 3 of the 5 participants are Black Africans. So it tells you which social strata that they fall into and how vulnerable they really are.
Yeah, no, absolutely. But I think what we found also, Tsepiso, is that in South Africa, we don't have a database of healthcare professionals. And we were struggling to get information for doctors, we were struggling to get, but the HPCSA helped. We were struggling to get information for nurses, where we could use it as a sampling frame and use it to adjust the numbers that we have. So we need to actually make sure that there's a clear database of all health professionals, both public, private, and those who are in the non-governmental society.
To get more accurate data. So which of the provinces is worst affected?
Well, I think that in terms of our sampling, we sampled mostly from the provinces, firstly from Gauteng, followed by Western Cape, followed by KZN, and then Eastern Cape. Those constituted about half of the participants.
So just let's go according to some of your findings. I'm interested in this, that 2 in 5 participants did not know the correct COVID-19 incubation period. What has been the effect of this?
Well, the way we're looking at it is because we did the study towards the end of April, early May, we're looking at it as the early aspects of the early stage of the pandemic in South Africa. We would have expected that at that time, close to 9 out of 10 healthcare professionals would already know the right information. But we were surprised that, it was only, 40% and 50%. So we have expected that the knowledge would be high if training was done, information was shared with them. But then the nurses were worst affected. The doctors were better off compared to the nurses.
But still, you find that 2 in 5 of those professional categories still incorrectly identified COVID-19 as airborne.
Yeah, so it was interesting because the study was done just after the World Health Organization had flagged airborne transmission, but then withdrew that statement. And then we did the survey, and then later on, they came back and said, actually, there must be airborne transmission. That for us signified the constant change in information over time when you're dealing with a new disease.
And also how it impacts those healthcare professionals who are supposed to be at the forefront of mitigating it. I want to talk about the perception of risks. Where was it highest? Where was it lowest, and why?
Yeah, the perception of risk is interesting. I think that we realized that the nurses were the ones who had the highest perception of risk, followed by the doctors and then followed by the other healthcare professionals, which makes sense. But we would have expected the risk perception between doctors and nurses. Now, we constantly, as I said, in this study found that the nurses were getting more of a raw deal. They did not get enough information, they did not get enough training, and they did not feel confident in their knowledge that they have. And all of these things contributed to the high risk perception. But the risk also had to do with the type of work they were doing, with the lack of concern about lack of PPE, and also the risk of taking the infection to their homes.
Professor, I wish we had more time to talk about what the greatest risk factors are and how to deal with them. But hopefully we'll continue this conversation at another time. Professor Mosa Moshabela is with UKZN Nelson R. Mandela School. Thank you so much for speaking to us.